terrible in terms of life expectancy, but in terms of the psyche of the nation, it's something that we really, really have to pay attention to.
So how do we solve that? Is it up to a healthcare system to solve that? Is it up to medicine to solve that? Should we have a greater focus on the importance of social services?
I think so. Look, if you look at other countries where they have been buffered against these same problems, right? You start to say, well, okay, they've dealt with the same problems, same challenges as us. Why don't they have the same then bad outcomes, these tragic trends as we do? And you do find that it seems to be investments in social systems. It seems to be investments in social cohesion. I mean, stress is ubiquitous, right? Everyone has it to some extent. Nations have it. Large communities of people have it. But why are some people so resilient to it versus others? And you do find that if you're not constantly worried about going bankrupt from medical bills, if you're not worried more about the cost of the disease versus the disease itself, if you feel like people are actually looking out for you in some way, then you find that these depths of despair really go down significantly. So I don't want to overly simplify it. I mean, gross, really, really blatant income inequality turns out to be a very stressful thing for society, no matter where on the spectrum you lie. Whether you are poor, or whether you are rich, whether you are a have or a have not, that ends up being something that really drives these deaths of despair as well. So there's all sorts of things. But to your question, you invest in social programs and you can see tangible results that differentiate these other countries from the United States. And there's really compelling evidence around that.
And I think, most developed countries spend 2 times the amount that we do on social services and have very good health outcomes. Why aren't we making investments in those areas?
I think it's been seen as too squishy, People have had a hard time defining it. What does it mean? What are we really getting in return for it? I mean, I think that even though the evidence has been there in other countries, frankly, sometimes, unless it's American-made evidence, unless we've figured it out ourselves in this country, we sometimes don't give enough merit or credence to the value of some of these investments in social support from other countries. I think that's partly what it is. And also, when you're benefiting a society versus individuals, those require big societal decisions.
Right.
These, at the state level, at the federal level. Our system's not really set up that way for so many things. Other than federal entitlements, where are the big investments?
Right.
Like if I said, hey, you know what? We should make a bold statement today that we need to invest in social cohesion in the United States of America. People would look at me sideways. Well, what does that even mean? Right? Well, look at other countries that are not dying from deaths of despair, that do not have decreasing life expectancy and increasing mortality, and see what they're doing different. It's not that hard. And know that we are all human beings. We can all benefit from these things in a similar way. We should go and find those solutions.
Absolutely. So at West Health, we commissioned a body of work around Meals on Wheels. And we found that 2 in 5 seniors in the state of California, of course, are living on fixed incomes, living at or below the poverty level, and have to make a choice every day between do I eat or do I pay for my medicine? And their health outcomes are terrible. And if we were able to deliver a meal to them, Meals on Wheels, for about $2.50 a day, the health outcomes change considerably. So this seems kind of like a no-brainer, right? Why is it so hard?
It shouldn't be. I mean, it should not be hard. And I think that people will look at something and they'll say, okay, I want to make it very binary. I'm investing X into Meals on Wheels. Here is how many people were fed. And that's obviously a very good metric.
Right.
But I think what we're understanding more is that what defines the fabric of a society. What makes someone want to go out and drink themselves to death or take so many drugs or, most tangibly end their lives by suicide? Yeah. What are those things, that are doing that? And getting a meal is obviously very important because of the meal, but it's also very important because it creates a fabric to a society that makes people feel more cared for.
How about compassion?
Yeah, back to that same thing.
Back to compassion.
We can define this. From people who say we can't define it, we can in ways that we haven't before, and we can define what the programs and investments look like that help arrive at a place where people don't want to die these deaths of despair. It's because it's happening, and it shouldn't be.
I know our time is almost over, but Sanjay, as a multiple Emmy award-winning journalist, as a neurosurgeon, as a very loving husband and a father to 3 daughters, what is your advice to your patients, to your family, to all of your viewers on navigating this healthcare system that is not transparent, that is fragmented, that is expensive? What do you think?
Well, I go through this as a physician. I go through this personally as well. My wife deals with chronic illness, and it's been very severe at times. And even as someone who knows the healthcare system, and as a journalist, I feel like I know how to find knowledge and information. It's really hard to do. People say, I want the best doctor for this. I want to make sure I'm taking the right medication for X, and those seem like really basic things, right? When my wife got sick, that's what we wanted as well. We want what anybody else wants, to get the right diagnosis, the right treatment, and to be able to do it at some sort of reasonable cost that wasn't going to make us think about cost versus disease, and it was incredibly challenging. So I do have guidance that I like to give individuals, but I preface it by saying that I don't want to lay this challenge solely at the feet of people who are trying to navigate the system at a time when they're really in need and vulnerable. Like all of a sudden the onus is on them to try and figure out something that is so hard to figure out. I mean, we need to change our society in terms of how we deliver healthcare. The basic idea that we're going to give people the right person, the right treatment, at an acceptable cost, I think is totally doable without sacrificing some of the bedrock principles that make America America. These aren't political decisions. These are just basic, I think, human decisions. But I think that's, I think as a basic step, one thing I think people should always do is try and be as engaged in their own health care as they possibly can. If you're being prescribed a medication or treatment, you're entitled to ask about whether or not you really need those things, whether there's other ways to do things. I think that, we do give a lot of treatment, a lot of procedures in this country, and some of them, to the extent that they're not always necessary, be actively involved in your own health care. And if you can't, because you're vulnerable, because you're sick, if you can find somebody who can also help you, be an advocate, I think, go out and get that knowledge and be informed as much as possible.
Sanjay, thank you.
Yeah, thank you.
I look forward to your next documentary being focused on cost.
Okay.
Shelley, Sanjay, thank you so much. Our next spotlight focuses on real people caught in the crosshairs of high costs and broken promises. Gail DeBoer, who lives with type 1 diabetes, is a powerful voice for patients everywhere who are struggling with the high price of insulin. In fact, today we had hoped that Gail would join us here in person, but she's lending her passion and her testimony to a recently called congressional hearing on the high price of insulin. Before she went to the Hill this morning, Gail taped this video for us.
Tim, thank you so much for inviting me to speak today. I really appreciate this opportunity.